question, bubo seen in which of the following conditions? So I hope all of you have marked this correct. Bubo, what is a bubo? It is a inguinal. In dermatological context, it is a inguinal bubo, which is suppurative lymphadenopathy, and it is seen in two important conditions. The first one is lymphogranuloma venereum. The first one is lymphogranuloma venereum, and what is the another one? The other one is chancroid. The other one is chancroid. Okay, so the answer for this is LGV. The next question is photosensitive rash over the neck region, and a few students told that Castle's necklace was given, or few students told that the image was given, so not sure. So whatever it is, photosensitive rash over the neck region, Castle's necklace seen in which vitamin deficiency? The answer is niacin deficiency, which is vitamin B3. Very, very, very important. It was asked n number of times in the past. It is going to be asked in the future also. Coral red fluorescence on wood slab is seen in which of the following condition? This was the question, and the answer is going to be erythrasma. Very, very important. Wood slab examination finding in erythrasma is coral red fluorescence. As you can see here, the web space is showing the coral red fluorescence. Coral red fluorescence. Okay. This is the next MCQ, treatment of this condition in a pregnant female, and students told that a picture of the genitalia having a rough surface was given, and if you are given this image, the diagnosis is going to be condyloma acuminata, which is basically produced due to human papilloma viruses. And please remember, very, very important, in the case of a pregnant female, we cannot use podophyllin or imiquimod. The reason is because they are teratogenic, and surgical excision is not an option. The answer here is going to be cryotherapy with the help of liquid nitrogen, which is going to cause the necrosis of the tissue of the HPV infected skin in the genitalia. And this is the next MCQ. A patient had a history of thorn prick while working in a rose garden and later observed linear spread proximally till the shoulder. What is the underlying cause for this clinical feature? And by this time, if you have identified the disease as rose gardener's disease, which is porotrichosis, you are absolutely right about the diagnosis, but the examiner is not asking about diagnosis, but he's interested in how the organism spreads in the body, and it spreads through the lymphatics. That is the reason why there are linear lesions, nodular ulcerative lesions, and it is lymphangitis. It is lymphangitis, which is the answer here. And this is the next MCQ. A patient presents with purple plain topped papules. And in the meanwhile, if you feel any question, body or the options are different in the exam, you can feel free to put that different thing which you have observed in the chat section or in the comment section. So patient presents with purple plain topped papules associated with pruritus over the wrist and the antecubital fossa, that is over the flexors, for a period of 2 months. What is the first line of treatment in this patient? Please remember, if you have identified that this is a condition where 5Ps are there and this condition is lichen planus, you are absolutely right in the diagnosis part. Next level is, what is the treatment? Please remember, lichen planus is a self-limiting condition, and we can give antihistamines, and if the patient is having more symptoms, then we can give topical steroids as the first line of treatment in lichen planus. So answer here is going to be topical steroids. This is the next MCQ. A patient presenting with nodular lesions over the face. There are nodules and hypopigmented patches over the trunk. Hypopigmented patches over the trunk. The most likely diagnosis in this case is going to be leprosy. Is the first thing which you are going to think about whenever you are having the hypopigmented patches over the body which are present extensively, and along with that, if nodular lesions are present, please remember the answer is going to be LL, which is lepromatous leprosy, which is very classical presentation in lepromatous leprosy. So this is the next question. All of the following are true about NF1, neurofibromatosis type 1, except So students told different options, but I think autosomal recessive was there in the option. And if any of the other options which are mentioned here are different, you can feel free to put it in the chat section or in the comment section. So optic glamma will be seen in neurofibromatosis type 1. Cafe ole macules are seen. List nodules are also seen. So please remember, NF is a autosomal dominant condition. It is not a autosomal recessive condition. So answer is going to be option A. Option A. I hope everyone has made this MCQ correct. And this is the next MCQ. Treatment of male partner is needed in which of the following conditions? So, okay, please remember, very important point. This you might have heard in the gynecology also. Bacterial vaginosis and candidiasis. Bacterial vaginosis and candidiasis, they are not considered as sexually transmitted disease. So, male partner treatment is not necessary there. And herpes genitalis, it is a recurrent condition where HSV virus is going to lie dormant in the dorsal root ganglion. So here the treatment is not going to be given in the male partner, only the treatment is going to be abstinence. So we are left out with one option, trichomoniasis, and yes, that is the correct answer, trichomoniasis. If a female has the trichomoniasis and if she is having the vaginal discharge, we are going to give the treatment to the male partner in this case. Hello, Dr. AKV. Sir, any malignant tumor not associated with NF1 was one of the option. Please, it will change answer. So whether one question for you is autosomal recessive given in the options, yes or no? And I didn't understand this. Any malignant tumor not associated with NF1 was one of the option. Will change answer. Yeah, malignant tumors are usually not associated with the NF1. Usually the neurofibromas which are present over the skin, they are going to undergo the ulceration, and that is the main problem with which the patients can present to us. Other than that, the patients do not have any other problem. Yeah, if autosomal recessive was not there in the option, can you please recollect what were the other three options? So one option was malignant tumors are not associated with NF1. So this is what I can understand from what you told. Please, all the other students, try to tell me what were the other options. Other three are same. This question very easily, bacterial vaginosis. This is a integrated question. We can say this comes also in dermatology as well as in gynecology. So this is bacterial vaginosis. And margins of the basal cell carcinoma, how are they going to be present? They are going to be, it is going to have a rodent ulcer. I hope all of you do remember this. And we have rolled out beaded margin. So these are the buzzwords related to basal cell carcinoma, which you need to remember, okay. A patient presented with annular plaque with scarring at the center. The lesion is present over the buttocks. What is the diagnosis? Please remember, the answer is lupus vulgaris. And if you can remember what were the other options, you can please help me out and put the other options in the chat section. Fournier's gangrene image was given, and it is basically a necrotizing fasciitis of the scrotum. So I think they gave the image of the Fournier's gangrene. They asked you what is this condition. So the answer is going to be Fournier's gangrene. If you can remember what are the other options, you can put them in the chat section. Bleeding gums are seen in vitamin C deficiency. Vitamin C deficiency.